So this is a recap to our pelvic floor series, part 1, foundations. So we're gonna understand the foundations. I want you to practice that pelvic floor contraction and relaxation. Key takeaways for today: understanding the pelvic floor. Our pelvic floor is the muscles at the bottom of our pelvic cavity, and they sit at the bottom of our pelvic cavity into our abdomen here, like my hands. The balloon is like our abdominal cavity. When we contract our diaphragm, our pelvic floor will go down. When we contract our pelvic floor, our diaphragm will go up, our belly will push out. So we want to practice contracting that pelvic floor first, practicing in a sitting position. We want to pull in through that pelvic floor, visualizing an elevator shaft, closing the doors at the bottom of that pelvic floor around your urethra, pulling all the way up to your diaphragm and holding that contraction, and then we want to let it go and feel the difference. You want to practice again, holding, closing, and going all the way up, visualizing an elevator shaft as high as you can, and you want to hold it as hard as you can and then let it go and feel the difference. So that's the practice of your pelvic floor contraction. We want to then integrate how we're doing that pelvic floor contraction into a bridge. You can add resistance around your knees or between your legs. You can use a Pilates ring or a ball or a pillow. And we want to pull in through that pelvic floor cavity. Again, trying to think of that elevator, pull up, 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 squeeze, keep holding, and then we can even add a bridge. We want to make sure we can feel that contraction through the pelvic floor and visualizing that line of the urethra up to the diaphragm, pulling up like pulling a elevator car through an elevator shaft. Squeeze, keeping that contraction as hard as you can, feeling that abdominal contraction and lift. We want to also integrate what's called our transverse abdominis. So we want to pull our belly in without changing our breath, pull up through that pelvic floor, squeeze and lift. So that's our strengthening exercise that we did for today for our pelvic floor. Then there's relaxing our pelvic floor. So for relaxing our pelvic floor, we want to breathe through our diaphragm. When we breathe through our diaphragm, our belly should push out and we're expanding, but we want to push downward also and feel pressure between our sit bones around that urethra. When you let that breath go, you should feel it recoil. So you want to practice. Breathe in, feel it push out, push downward with your breath all the way into your pelvic cavity. Feel that pressure. As you breathe out, you should feel it recoil. So continue to practice that so you can feel the pressure outward and feel that recoiling in. We then want to progress by adding that into a child's pose position so we can stretch outward. And in this position, when our hips are flexed, as we breathe in and push out through those sit bones, through that pelvic floor, we should feel like it's a little easier to get farther and more stretch. And then we can rock up, let it go back in. And then we rock back and push out again through that pelvic floor by taking a breath in, pushing downward, feeling some pressure through our sit bones and around the urethra. You can lastly advance this to a squat. So as we're getting into a squat, we should feel combining the two. We want to push outward through that pelvic floor, feeling that relax and push out. And then we want to contract, try to pull in from here and stand. And you want to practice pushing out as we go down into a squat and feeling that pelvic floor stretch. Feel that pressure, try to pull in through that pelvic floor, feel that contraction and stand. So practice these exercises for our foundations and go over these again and again so we can get more comfortable with pelvic floor contraction and relaxation.